Okay, I want to thank you for visiting with us today, and our topic this month is glaucoma. And if you don't mind, if you would introduce yourself to everyone.
I'm Dr. Kyle Cooke. I'm an optometrist and the owner of Mansfield Vision Center.
Okay, and how long have you been in the area, just curiosity?
I've been practicing since '94, moved to Mansfield in '98, and we opened here in July of '03. Okay. So 14 years in Mansfield now.
Okay. So glaucoma, what is it?
Most types of glaucoma are caused by a high pressure in the eye, and the elevated pressure in there is killing nerve fibers up against the retina, which in turn causes optic nerve damage. Just about all glaucoma is because of a high pressure in the eye. There are patients with pressures that are normal that can have glaucoma, and we're still not sure of the mechanism as to why that happens. But most types of glaucoma are primary open angle, just the angle is open. The angle is where the fluid drains from the eye. It's formed by where the iris meets the cornea. The fluid in the eye goes through the pupil and drains in that angle. And most patients with glaucoma will have an open angle, but the problem is in the drainage system. There's some kind of genetic factor there or a mechanical factor, like the shedding of pigment from the back of the iris that can make, now the fluid can't drain properly and the pressure starts getting elevated. But as I said, some patients will have glaucomatous nerve damage, but their pressures are normal, and we're still not sure what causes that.
So if you have sometimes have a hard time saying it, glaucoma, what are the symptoms that you experience?
In the rarer type of glaucoma, we talked about open angle. There's angle closure glaucoma too. There's a sudden precipitous event, usually from the pupil dilating and the iris bunching up in that drain and blocking it. In angle closure, there's usually very fast symptoms, a painful red eye, halos around light, very painful, clearly something's wrong, and angle closure is considered an emergency because those pressures will go up. Normally, a healthy eye, the pressure is 10 to 20, but with angle closure, the pressure can quickly go up above 50. And that's an emergency. But again, that's the rare type. In open angle glaucoma, usually there are no symptoms until the disease is very advanced. There's not a lot of pain receptors in the eye, and patients that have moderately high pressures like 25 or 30 can slowly be losing vision and not even be aware of it. You don't see that much in the United States anymore. I mean, patients coming in with really advanced and they didn't know it. But it has to be very, very far along for the patient to start noticing they're missing sections of their vision.
Okay. So, do we know what causes glaucoma?
Mostly genetic predisposition. I mean, we've identified several risk factors for it. Family history is one. Family history certainly can predispose someone. They're at a slightly higher risk than someone without a family history. Glaucoma is actually 8 times, there's an 8 times higher incidence in African Americans. They're particularly at risk. Age, something magic about 60. Statistically significant increased risk after 60 years old. High myopia, patients that are very nearsighted, or patients that are hypertensive or diabetic are also at a slightly higher risk. And then a history of trauma. If they'd ever been hit in the eye, they can develop a secondary glaucoma from that. It probably causes some kind of damage to the drain, and the pressure starts going up. And that can happen right after the trauma or even years later.
Okay. So how do you treat it? What's the treatment for it?
The vast majority of glaucomas are pretty treatable with an eye drop. The problem with a lot of our treatment mechanisms is all of them really are designed to lower the pressure. And like we talked about at the beginning, not everyone with glaucoma has a high pressure, but luckily most do. So mostly eye drops once or twice a day to lower the pressure. To lower the pressure some, you can stop that nerve damage from occurring. Patients with a normal pressure, much harder to treat. That type of glaucoma is tough to treat because all of our treatments are geared towards lowering pressure. And then there's surgical options too. The big two are a laser procedure to the drain. They can put something on the eye with a mirror that can shoot a laser sideways into that angle and it causes a little bit of scarring right next to that drain, which as it scars, it opens up the pores so the fluid can drain and lower the pressure. And then sometimes they'll do a bleb, a filter where they go into the eye with this tiny little piece of plastic that drains the fluid from the eye into the space between the white of the eye and the conjunctiva. And surgically, you go that option when you're either not controlling it with the eye drops, or maybe really older patients. They're not real compliant sometimes with their drops, and they're just forgetting to take them, and you have to sometimes move on to a surgical option.
Out of all the things that you deal with, or eye diseases that are out there, how prevalent is it in comparison to other things?
I believe it's the #2 cause of blindness in the United States. Cataracts are worldwide.
Okay.
And cataracts would be #1. We see a lot of glaucoma. I mean, we'll probably diagnose 2-3 patients a week.
Wow.
It's a pretty common eye disease.
But cataracts are more common than...
Yes.
Okay. And what is, I mean, just briefly, what's cataracts?
Now, a cataract is, a lot of patients will sometimes describe a cataract, or somebody they know that has one, they've got a scar on their eye, they can physically look at their eye, oh, that's a cataract.
Yeah.
That's probably a corneal scar if you can see it with the naked eye. A cataract is deeper in the eye, right behind the color, the iris, and the pupil. And just as with the natural aging process, they're transparent when we're very young, but as we age, they tend to lose a little bit of transparency and causes blur and loss of vision. But cataracts are a piece of cake to treat. I mean, that's the most common surgical procedure performed in the United States, and 15-minute surgery and the patient sees again. We don't get worked up over cataracts. We honestly don't get too worked up over glaucoma. It's usually fairly easy to treat, but you never cure it. I meant to say this earlier.
Yeah.
Patients have to maintain with the eye drops probably the rest of their life. Or have the surgical procedure, and maybe they get the pressure lower enough they don't have to use the drops anymore, but you never cure it.
So what's the one thing that you would recommend as far as eye health and taking care of your eyes?
Well, we've known for years that ultraviolet exposure contributes to cataract formation. We're seeing very strong evidence now that it also contributes to macular degeneration because of the yellow pigment in the macula likes to absorb that blue light. So wear your sunglasses. Even, interestingly enough, I read one study that said something like, I want to say it was about 70% of our lifetime's exposure to UV occurs in our teenage years.
Oh, wow.
So even our pre-adolescents and teenagers, we want to start them young wearing sunglasses. And might certainly drop the risk for cataracts and macular degeneration. And the antioxidant vitamins, vitamin A, C, and E, of course carrots chock full of vitamin A. That is not an old wives' tale. Carrots are very good for the eyes.
Okay. Excellent. Anything else you want to add?
No, a lot of times patients will ask about, what can I do, to try to prevent getting glaucoma. There's really not a lot we think that you can do.
Don't get old. Don't get old.
Well, and don't have a family history, but the good news with glaucoma, just like a lot of things with the eyes, the key is early detection. Because if you catch it, like we were talking about earlier, patients won't know anything's wrong until it's very advanced. We don't want to go that long. We want to catch it as early as we can and prevent any further damage. So just like macular degeneration is the same way. Cataracts, not so much. In the United States, they don't reach the point where we've gone too long, and that's going to be really hard to get that out. Early detection, so that just means get your eyes checked, if not every year, at least every 2, even if you don't need glasses.
Okay. Okay, thank you very much.
Thank you so much. I appreciate you coming. I appreciate you asking me to do this.
Okay.